Mr. Chairman, what is different about this better deal, as it's being called by your colleagues in Congress, this better economic deal than what we've seen from Democrats in the past?
Well, we're clearly articulating what we stand for. We've been fighting since really the founding of the party to make sure we're improving people's lives. It's why we fought for Social Security. It's why we fought for Medicare, Medicaid. It's why we fought for higher wages, for the right to organize, for union members. And what this better deal is about is making sure we're fighting for the things that are keeping people up at night, making sure that we address the abiding issue of our time, which is income inequality. The Democrats have been fighting for higher wages. When I was the labor secretary, I was fighting to make sure that if you worked overtime, you got paid for overtime. I was fighting for retirement security, and Republicans were fighting against everything we were trying to do. We're standing up, putting our beliefs in action, telling people what we stand for, and fighting for it every day in every zip code. I think this message resonates in rural America, urban America, all across America.
And one of the things that stood out in particular about this plan, and I'm hoping you can elaborate on it, is this idea of breaking up corporations, and it would establish a new entity that would be designed to do that because you know, the argument being from Democrats that businesses are getting too big. How would that work?
Well, here's the bottom line. Corporations in this country, I mean, when you look at where the balance of power is, the little guy is getting screwed. And you know, there's too much power concentrated in too few. And we've seen that manifest itself in so many different ways. And that's why people feel like this system is absolutely rigged against them. And that's why and then you look at the debate right now in Congress, where the Republicans in Congress and President Trump want to basically emasculate the Consumer Financial Protection Bureau, which was a critical part of the infrastructure of consumer protection established after the Great Recession. And it's done wonders to help average Americans get access to basic fairness. And you see Republicans, they haven't learned the lessons of history. They believe that if we concentrate power in the hands of a few, benefits will trickle down. Trickle-down economics has not worked for average Americans.
But is this a more populist message? I mean, is that what we're seeing here as we head into the midterms, that the Democratic Party is trying to adopt more populism, go more toward the left, like Senator Elizabeth Warren and Senator Sanders? Is that what this is all about?
Well, we're fighting for what my former boss, Ted Kennedy, fought for his entire career in the United States Senate, which is fairness and opportunity for everyone. We want to make sure we're fighting for the issues that people care most about. They want a good job that pays a fair wage. They want to make sure that if you work 40 hours a week, you can feed your family. They want to make sure that health care is a right for all and not a privilege for a few. That when you work 30 years and you get a pension, you can count on that pension. Those are the issues that Democrats have always been fighting for. That's the essence of the better deal, which is to make sure that people get a fair shake. That people, when you want your kids to go to college, you don't have to take out what amounts to an educational mortgage. We should make sure that pathways to either college or apprenticeship or any sort of career readiness potential, that those pathways are accessible to everyone. Too many people feel like the doors are closed for them, that the system doesn't work for them. And what we're doing as Democrats is clearly articulating what we stand for and putting those values into action and contrasting them with the idle chatter and the empty talk of this administration,
well,
where
let's talk more
talk
about
a mean
that.
game
Let's
about
talk more about
jobs, but
healthcare.
they don't do it.
Let's talk more about healthcare, because, of course, that's dominating the discussion here in Washington. Do you think that a skinny version, as it's being called, would attract any Democratic support in either the Senate or in the House of Representatives?
No, and here's why. A skinny version is only designed to get to a conference committee, and the conference committee is going to be hijacked by the Freedom Caucus. We ought to be following two rules in this healthcare debate. Rule number one is do no harm to people, the millions of people who've already benefited from the Affordable Care Act. And rule number two ought to be, when you're trying to improve on the Affordable Care Act, does your proposal increase access to quality, affordable health care for people? Those are the two rules that ought to govern, and every bill they've put forth fails miserably. The so-called skinny bill would make it more expensive for people to get health care, because you're basically inviting healthy people to leave the insurance market. And so they decry the fact that premiums are going up, ignoring, of course, that people get subsidies. But they decry the fact that premiums go up, and then they put a proposal on the table that's going to increase premiums. They're violating the basic Hippocratic oath of policymaking. And that is why...
I've got to ask a follow-up question on this, because I hear you on that point, but then I take a look at the economic plan and I see the effort to appeal to states like Pennsylvania, Michigan, and Wisconsin. A lot of those voters, you know this, a lot of those voters voted for now President Trump because of high premiums. So can what the message you're saying on health care resonate with the better deal economic message?
Oh, absolutely. A lot of the voters who voted for Donald Trump also have they're confronting a family member who has a pre-existing condition, or a family member or friend who is struggling with opioid abuse. Donald Trump told them in the campaign that he was going to enhance access to health care, that he wasn't going to touch Medicaid. Those were his promises. Those aren't my words. Those were his promises. And he's breaking those promises left and right, because the House bill and the Senate bill, they're both trying to change and undermine Medicaid as we know it. And so we believe that health care is a right for all, not a privilege for a few. And if you're struggling with any of these challenges, whether it's diabetes, whether it's opioid addiction, you need this health care. It's your lifeline, and they're going to make it harder for you to get it. So I welcome that debate. I think the American people clearly understand now that Democrats believe that health care should be a right for all and not a privilege for a few. And what Republicans want is a tax cut for wealthy people who don't need it and corporations who don't deserve it.
Opioid addiction, apprenticeship programs, hopefully somewhere in the middle of all of that, Mr. Chairman, we can find some type of bipartisan, nonpartisan consensus. Thank you so much,
I'd love to find that consensus.
Yeah, so a lot of Americans would too. Tom Perez, the chairman of the Democratic Party, thank you so much for coming on Bloomberg.
Great to be with you.